Hello and welcome back to my YouTube channel where you can join a like-minded community of individuals who want to learn about their health, and in learning how to ask different questions about what's driving health, begin to make some changes to look good, feel good, and live well. My name is Scott Resnick. I'm a conventionally trained medical doctor, but over the last 10 years I've refocused my efforts to understand how different systems in the body relate in a functional aspect. This is functional medicine, and I believe it's the practice of the future. I believe that cortisol is the king of hormones, and in an earlier video, I think if I do it right, I can link it up there. I explained how cortisol impacts every system in the body, from the skin, to the heart, to the lungs, to the brain, to the gut, to the kidneys, to our reproductive system. All of those different organs depend on cortisol signaling. Cortisol, as you know, is secreted by the adrenal gland, and if you open any biochemistry book, you will see that its primary job is to raise our body's blood sugar. It does so by working within what I like to refer to as the energetic triad of hormones. These three hormones collectively work together to maintain our body's blood sugar to basically keep our heart and our brain alive. The three hormones are thyroid hormone, insulin, and cortisol. And they work together like three legs of a stool. And when you understand how cortisol is secreted over the course of the day, which I'll show you a little later in this video, then all of this begins to make sense why cortisol is so important for the body. I want to start with a story, and I'll tell you that the cortisol curve that I'm going to show you initially, after I get done with this introduction, belongs to a patient of mine, and I'm going to use that to show you what a normal cortisol curve looks like over the course of the day. But the punchline is that she didn't have this normal looking curve when she first came into my care, and I'm going to show you what her initial cortisol curve looks like, because when you see how different the two look, then it begins to make sense that she initially presented to me with all kinds of complaints of low energy, brain fog, weight gain, menstrual abnormalities, and the list went on. What I'm showing here, as I'm going to take my mug out of this frame here and get to the science. So what you'll see here is a standard 4-part salivary cortisol curve. Now what this is, these are 4 salivary cortisol collections made over the course of the day. Those are depicted by the small black dots. On the vertical or left axis, you see the measurement of cortisol in nanograms per milliliter. And on the x-axis, you'll see 24 hours in a day. And it's clearly apparent right off the bat that cortisol changes over the course of the day. It's a diurnal hormone, which means its secretion fluctuates over a period of time. And you will see right away that it peaks at maybe 3 to 4 or 5 o'clock in the morning. Why is that? Well, that goes back to my energetic triad. You'll remember that cortisol's job is to basically maintain our blood's glucose. But at 3 or 4 in the morning, we typically haven't eaten for a good 6 to 10 hours. So we're in a relatively low glucose state because we're not taking in glucose as we sleep. Our adrenal glands raise the levels of glucose, and what that does is, in doing so, it raises our blood glucose, but it also inhibits the effects of insulin. Recall that insulin's job is to lower our blood sugar and to take that excess blood sugar and to put it into storage. Cortisol secretion also, over time, impedes our thyroid secretion, and that makes sense as well, because if you're in an environment where you're not taking in food, like maybe you're starving, you don't want to have a thyroid gland and a metabolism that's running full tilt. When we look at this graph, I want to remind you that the shaded area represents a normal amount of cortisol secretion. So over the course of the day, you want to see your cortisol follow that normal pattern, and ideally as close to the middle as possible. Having looked at a normal cortisol curve and a normal DHEA, I want to introduce to you now my patient's curve from a year and a half prior to her normal cortisol secretion. You can see that her DHEA was very, very low, as was her cortisol over the course of the day. And it's no surprise that she basically felt fully de-energized with any number of different symptoms. Now I have to tell you that this relationship between DHEA and cortisol is really cool, it's really important, and I really can't get into it in this video, so I'm going to have to make a video that explains these relationships. But with cortisol, we want to see DHEA. This is an anabolic hormone in the normal ranges. Hers were clearly out of range. So this is why cortisol is so important. Not only does it affect all of the other organs in our body, but in maintaining our body's blood sugar, it has such a great importance that our brain actually controls the secretion of cortisol to change over the course of a 24-hour period. Once again, I'm Scott Resnick. I'm making these videos to help to educate you so that you understand how these different systems and components of your biology all fit together to either make you well and feel good, or not well and feeling poorly. I want to see you in that former group. Of course, comment, subscribe, make a suggestion. I might even make that video. Either way, I will see you next week in another video. See you then.